Hey guys, it's Saving a Life Mattered. This is Joseph David again, and I just wanted to talk a little bit about hospital discrimination and how bad it is for patients that are SAMHSA. And SAMHSA represents substance abuse, and it also represents mental health. And I think the whole labeling of everything is kind of incorrect. But if you're labeled, and you shouldn't be labeled anything at all, I believe it goes against our constitutional rights. And walking into a hospital and having someone automatically look at you as you're an addict and they label you just because of what your paperwork automatically has to say, because of what the state of Florida started with all of these pain mills and pills, and that's what they started. And then they turn around and they get you all strung out and all messed up, and then they turn around and they want to pass all kinds of bills for lobbyists and these big pharma companies and pharmacies, and it's really sad, and it's incredibly so it's so popular these days for somebody who has addiction to walk into the hospital and to not get what they need. Like, imagine if somebody's in severe pain and somebody doesn't want to help them out. Do you know how many people have adult ADHD, but they can't get the correct medication that they need? Do you know how many people get turned down by pain management, even when they want to say they want a holistic approach? I mean, if you would walk into a pain management clinic and at least say, hey, is there any way we could do a holistic approach in the state of Florida? I mean, especially considering, with the passing of the medical marijuana and the fact that, I guess, Medicare or Medicaid, I'm not sure, but if you were, say you were struck by a train, right? Because that's what happened to me. I was struck by a train. And you wanted to get help. And the second you walked into a hospital, and you're recovered, you're 100% recovered. You can, but you on your paperwork, somebody's reading everything about you, and you're automatically labeled an addict. Well, how come other people aren't stereotyped and automatically labeled as something when they walk into the hospital? I want to ask all my followers, I want to ask all my subscribers out there, and I want to ask you for your opinion. Do you think it's against constitutional rights for there to be discrimination in hospitals or communities or anywhere in general? Do you think that's okay? Do you think that there needs to be a new law passed for HIPAA that says, I'm sorry, you can't have any of my information, but you can have my urine if you ask for it, or you can have my blood if you ask for it, but you can't just take that from me, and you can't just label me something. And that's what's happening. That's what's happening across the whole entire United States. And you know what's crazy is it all started in Florida. Florida wanted to start all this. They started all these pain pills and all these mills and all these doctors, to allow all these doctors to make all this money, and then they turned around and they arrested them all after they gave them the ability to do all what they did. And now people are suffering out there, and they turn around and they write something called buprenorphine, Subutex, Suboxone. And you want to know the crazy part? It's worse. It's even worse of an addiction to come off of than the actual pills that they made. And that's the saddest part, is they want to replace something that makes it 100 times harder for to me, I don't even want to call someone an addict. I mean, that's like telling somebody who goes to listen, discrimination's wrong. Walking into a hospital and not getting help because of you're labeled by something, and automatically having them have a label over your head before you walk in, and them not treating you because of certain things that are put in your medical records that are going to stay with you for the rest of your life. And then if a medication has potential, let's say a medication has potential, what's the word, possible effects for abuse, but you really need that medication. Are you going to be pissed off if you get sent to another specialist and another specialist and another specialist just to be told, hang on, I need to write you to another specialist? Just because of HIPAA has to label and go against constitutional rights, which is, it's not okay. It's not okay at all. And I do believe that addiction is a disease. I do believe that it is a sickness. And I do believe that it is hereditary. I do believe that there is a way to making mental health awareness more available to people, especially at a younger age, because it'll prevent addiction. And if hospitals become a little bit more certified and they have a little bit more help, because I know hospitals right now, I know everybody's doing the best they can, and it's overwhelming with the pandemic. And I'm not trying to be a critic on any doctors or any nurses or anything like that. That's not what this is about. It's not what that's about. It's about, there needs to be more awareness, especially at youth and at younger ages, for mental health awareness. Because if you can point out, or if you can figure out at a youth age that someone has a mental health illness, then you're most likely going to save them from a habit of addiction. And if you give somebody the correct medication rather than turning them down, then the state of Florida, which is monopolized and it's economized by the prison system, then somebody who gets turned down doesn't have to go somewhere else to get a medication that actually helps that person. And it's just so sad, the discrimination. And it's so sad that we have so many lost lives. And Saving Life Mattered, it's in past tense because it does represent a lot of my friends that have passed away. It represents a lot of the people that aren't here today. And what I want to start, it has a lot of value to it, has a lot of meaning to it. And people might say, well, Saving a Life Mattered, what sense does that make? Well, it mattered to the people that aren't here. It mattered that there was an answer for them. And it mattered that it usually starts with mental health. And if somebody can spot out mental health before addiction, usually it can bring out more awareness before somebody is completely taken over by something. And I do believe that, there needs to be more professional teaching out there for mental health awareness, especially with this pandemic, especially with COVID-19, because it does affect your mental ability when you are sick. And it does, look across the United States, look at everything that's going on. Just look in the state of Florida, look at all the crime, look at the crime that's gone up. And it's not just because of the racism, it's not just because of the politics, it's not just because of the election, it's because of mental health. And mental health, it really needs to be approached differently. And people need to stop being discriminated upon. That's my biggest thing right now, is because of what I went through in the hospital. And I shouldn't have left the hospital the way I left. I should have been able to go to a physical rehabilitation center to get the help that I needed. And when I went back to the hospital after I got struck by the train, after several months later, I couldn't. I was in so much pain, and they had to tap my lungs to get the fluid out. And in order for me to get out of pain, I couldn't. And that's the sad part, is there was no one there because of the labelization of somebody being an addict. And I want to go to the United States Supreme Court Justice. I want to go to a federal attorney, and I want somebody to stand up for the rights of people who are being denied health care or health services because of the labeling. And nobody has the right to label anybody as anything, especially in the United States of America. And that's what this is about. So mental health awareness, especially right now, and the fact that there's a lot of people out there that need help and services that, that there's just not enough funding for. We need to figure out a way to support this. And at Saving a Life Mattered, I feel like bringing that to an attention and bringing that to an organization, I can do something to change that. So you guys have a great night. And if you like this video, please click like and please subscribe. Please keep following me. I'm going to tell you all about my journey and more about what happened to me with the train and how I got hit on foot and how I coded 4 times in one night and how I died before I got on the helicopter and how I came back to life to be able to do the things that I'm doing today. And if I didn't go through what I went through, I don't know where I'd be today. But gratitude is a beautiful thing, emotional. Don't forget to hug anybody, give somebody a kiss. You're spiritual, do a little bit of meditation, do a little bit of praying. Mental, you've got to be mentally tough with everything. It's more than just 80% mental. Life is just mental, it's mentality. And then physical, you guys, if you just do something, even if it's just a few push-ups, go for a walk. Just do something and balance those 4 things. You guys are going to have a nice life. But my main focus right now is discrimination in hospitals. We got to stop that, and we got to fix what's going on. And if we can fix it at an earlier age, and especially at a youth, we can be more aware of mental health issues as is. And I think if we can do that, we can recognize the fact that we can save a lot of people from even being addicted to things because of mental health awareness. So Saving a Life Mattered. I'm going to let you guys go. Thanks for watching. Thanks for tuning in, and have a great night.